today I'm talking to Katherine Boydell, who's Professor of Mental Health and heads the Art-Based Knowledge Translation Lab at the Black Dog Institute. Her background is in community health and epidemiology and qualitative sociology. So we'll start by, perhaps you can tell me a little bit about arts-based knowledge translation.
Okay, Gail, it's an interesting term and really have used it to depict the ways that we're drawing on the arts in the research process to translate knowledge. And it really originated probably a couple of decades ago, actually, with my frustration as an academic with that research to practice or knowledge to practice gap. So one of the, I guess, challenges in academia is our key audience are other academics and other scholars, which is very important, of course. And academic currency is typically measured by your peer-reviewed publications and your scientific presentations. And I think that's wonderful. That's a really important audience. But I think the problem is the research that we produce fails to reach the people who need to know, or often fails to reach the people who need to know. So service providers, policymakers, healthcare consumers, and their families. And I guess the problem is, and what we've heard from these key stakeholders is that we can't access those articles. If we do, we don't understand the language. Policymakers, for example, will say we don't have time to read those papers. So really it came about sort of thinking about other ways to share our research findings with different stakeholder audiences. Now there's a huge, burgeoning evidence base around knowledge translation and how might we think about strategies to share our research. And I guess for me in particular was a focus on using the arts, using visual and performative and literary means to share, disseminate knowledge and measure the impact of doing that. But I think it's more than just thinking about disseminating research knowledge. It's also about how might we consider different ways of engaging our research participants in research. So in addition to, the psychometrically tested measurement tools and surveys and interviews and focus groups, what are other ways in to, I guess, explore a lived experience of whatever it is, an illness, an issue, a social context, an intervention, a service, that draws on those arts-based genres to allow research participants to think about other ways to depict those experiences. So sort of long-winded way of saying that sort of arts-based knowledge translation, looking at how might we use the arts broadly defined to produce knowledge in that creation process, disseminate knowledge and measure the impact of that. What impact does it have on our research participants? What impact does it have on our targeted audience members?
And why the arts? Why use arts in research?
I think the arts, just in terms of their power, their I guess, focus on embodied ways of knowing, which I think in the mental health field, which has largely been my focus of research, has been really important because often there's been that kind of dichotomous split between mind body. And I think using the arts really brings those together in a powerful way. And I think also the power of the arts to evoke and provoke. Certainly in our experience, we've heard from research participants who have said to us, I've never had a chance to really think about my experiences in that way. It's allowed me to be reflexive, or I've been able to express what words have been woefully inadequate to express. So again, I think it's a different way in and has provided us, I guess, with another addition to, I guess I think about sort of a researcher's toolkit, if you will, and it just adds to that toolkit by allowing other ways of knowing or privileging other ways of knowing that are performative or visual, or even thinking about the literary to, use words and text, but in different ways that again might perhaps be more powerful, evocative, allow us to, instead of a 12-page research article, in a very succinct poem, for example, to really depict the main findings of a research project.
And can you describe some of that arts-based knowledge translation? How does it produce knowledge and how do you disseminate that?
Yeah, it's a great question, Gail. I guess I'm just going to reflect back to one of the very first arts-based research projects that we engaged in. And it was a study that was focused on access to mental health care for children and youth in rural and remote communities. And it was a qualitative study, and we interviewed 30 caregivers, 30 service providers about what were the challenges and barriers to accessing care in these communities. We had a beautiful, lovely, rich data set, and we had built in a pocket of funds for the end of the grant to hold a policy forum. And in our advisory group meeting, our advisory group, and in fact, it was a rural GP who said, you know, I've been to so many of these policy forums and it's just like a talk fest, and I'm not really sure how useful that will be. Perhaps we can think about another way of sharing these findings. And another comment that she made, we were looking at some visual images that we had selected for the cover of the report. And she said to us, to the committee, this image, and I have this image, it's such a beautiful, powerful black and white image of a little girl, maybe 7 or 8 years old, and it's just her back, and she's kind of holding a teddy bear, and it's hanging from her hand. And this rural GP said, you know, I get so many reports, and I'll tell you, to be honest, they go to the bottom of the pile, and I'm lucky if I open the first page. And she said, if I got the report with this page on the cover, you know what, I'd actually open the front cover. And so again, it kind of pointed to me, it's, wow, the power of the visual. So what we did is we used those funds. Instead of a policy forum, we partnered with the film department at the local rural university, and we used those funds to produce a 52-minute documentary based on the research findings. And then we took that documentary to the rural communities where the study took place, and we held a town hall, and we invited service providers and family members and just the general public to view the film and to enter into a discussion about what could the community do differently to address some of these barriers. So that was sort of my entree into, wow, the arts actually can do something here. And I guess that was just sort of the beginning of engaging with digital storytelling and found poetry and installation art and research-based dance and body mapping, et cetera, et cetera. So drawing on the arts in the research process.
Fantastic. What are the consequences of that, the short-term, long-term of working with research participants?
I think with the research participants, one of the first things that we're always very careful to sort of ensure that our audience knows up front is that we're engaging and using the arts and working with artists in the research process with our research participants, that it's not art therapy. So it's not art therapy. However, it is therapeutic in its consequences. I mean, there's absolutely no doubt. So in our research projects, we view the process as important as the outcomes. We are always studying the process of engaging research participants in this way, asking them to reflect on what it was like to, collaborate to create or co-create a mural, to co-create a script, to co-create an installation, whatever it is. And what we have found is that people are engaged. So there's that sense of engagement. So even over a long period of time, over weeks, our loss to follow-up is just so minimal. So again, that's quite unique in the research process, where we're typically, quite used to having, a fairly, at least, 10 to 15% dropout rate. So we find that people are quite engaged in the research process. We find that there's a sense of community cohesion that's built in working together and co-creating together, sense of capacity building, of camaraderie, of empowerment, really feeling proud of creating this artwork, and so much so that we've done a lot of thinking and writing about some of the ethical implications of involving research participants in this work. So issues of anonymity and confidentiality, where people really want to be identified with their work, they're quite proud of it. Issues of ownership of the work. We've also addressed issues of dangerous emotional terrain. So ethics committees have often come back to say, what are the, if this is just so powerful and embodied, what are the dangers of being involved in this work in such an intimate way? So we've addressed those kinds of issues. What do we have in place to ensure a safe place or space to engage in working and creating in this way? But ultimately, our experience has been quite positive in terms of what are the impacts on research participants of being involved in this work. In fact, so much so that they are constantly asking what other projects can they be involved in, that it's unfortunate that this particular research project has to end. In some situations, we've actually had continuation of the group that has formed for research, just to sort of continue on in terms of meeting together and creating together, which is quite interesting. And then from the other perspective, when we think about the dissemination or communication of results, we've got a great interest in measuring the impact of that on audience. And I'm always, when I talk about it, I just feel like I always have to put these sort of, scare quotes around measure and around impact, because I think it's quite different from what scholars might typically think about from a more positivist perspective in terms of, how do we measure impact? And again, it really depends on what our goals of that dissemination are. Are they to enhance awareness or understanding? Then that sort of calls up a different way of measuring response. Are we interested in measuring mental health literacy or literacy with respect to specific populations, like young people experiencing psychosis? Are we interested in behavior change or practice change? So that sort of calls up different ways of what we would measure. We're often really interested in measuring stigma. So by communicating our research results in this way, does it decrease stigma, for example? So one of our projects was disseminating a research-based dance around pathways to mental health care for young people with psychosis. And we took that performative piece to secondary schools in inner city and rural communities. And one of the things we were interested in measuring or exploring was, does being involved in a presentation and a post-performance talkback have an impact on help-seeking behaviors and on stigma? And we found, in fact, that it did. But again, your question about short-term versus long-term effects is a really important one, because I think one of the gaps in the current sort of arts-based health research literature is the lack of longitudinal work. So we know that certainly up to 6 months, we've seen, enhanced mental health literacy, enhanced knowledge of psychosis, decreased stigma, significantly increased sense of empathy and understanding and awareness of an issue, intent for practice change, some increase in help-seeking behavior. But, of interest is, what are the longer term impacts of this work? I mean, I would suspect, because people seem to remember, so I think it does something to what you remember, perhaps because it's a more unique way of sharing research. And I think about even myself, I can tell you, I probably sat in hundreds and hundreds of lectures or talks, and many of them quite brilliant, but do I remember them? No, but do I remember the one performative piece sharing research? Yes, I do. And that was like, I don't know, 25 years ago. So again, kind of the impact that it might have on a longer term basis. But I do think there's a lot of work to be done in that space to explore longer term impacts of using the arts as a knowledge translation strategy.
And when we think about this year in particular, 2020, why do you think this is so important in a year like we've had, that we have these approaches?
Well, I think just simply from, I guess, the social media, sort of the inundation of offerings that are really focused on the arts and creativity. So I think sort of in a year that we've been impacted by the bushfires, by COVID, that people have really turned to arts and creativity as a coping mechanism. There's sort of been, virtual museums and virtual art galleries and virtual zoos, and people have turned to puzzle making and paints. I mean, I know I tried to order a canvas and some paints a couple of months ago, and everything was absolutely sold out. You couldn't get anything. And I think that just sort of highlights the way people were turning to the arts. So I think a lot has been highlighted. I mean, it's been unfortunate to me that there's kind of been this tension around the valuing of the arts from one perspective in terms of funding, and yet this kind of disjuncture where people have been turning to the arts in a huge way. And I sort of think about it quite broadly to incorporate, creativity and cooking and bread making. I think you've just sort of seen it everywhere. So I think it's more important than ever. I think people are really realizing, acknowledging there's been a lot of writing and literature. I think in the last year, there's been sort of key World Health Organization reports that have highlighted the importance of the arts broadly defined, not only on our mental health, but physical health as well. So I think it's the time is right to really highlight these sort of wonderful findings and the ways in which the arts have actually helped during times of COVID or during a pandemic or times of crisis.